Good afternoon, everyone. Thank you so much for joining us today. For those of you who are new here and don't know who we are, here in Ontario, the Low Income Energy Network is widely recognized as the primary go-to organization with expertise on low-income energy issues. LIEN was formed in 2004, and we are a network of community legal clinics, anti-poverty groups, affordable housing groups, environmental and social justice groups. LIEN represents over 60 member organizations across Ontario. And if you are a nonprofit or non-governmental organization, you can sign up to become a member of LIEN, and membership is free. You can find more information about that on our website. As a network representing the intersection of interests related to low-income consumers and energy and sustainability, LIEN's focus is on reducing the energy bills of all low-income consumers and ensuring that they're provided with the opportunity and the tools to better manage their energy bills. So now on to the reason we're all here today. LIEN's annual conference is an opportunity to celebrate our achievements, but also to work together to help advance our vision to end energy poverty in Ontario. Climate change disproportionately affects vulnerable and marginalized communities and will continue to exacerbate energy disparities. As the planet heats up, extreme weather is felt unequally, both across and within countries. Rising temperatures and extreme heat events create and exacerbate health inequities. The elderly, children, and people with chronic diseases or those who are on certain medications are the most sensitive to heat. Extreme weather events are expected to increase in the coming decade, but Canada continues to remain unprepared. David Phillips, the senior climatologist at Environment Canada, recently warned that the recent heat waves are really a dress rehearsal, almost the opening act of what we're going to see more of. Extreme heat events introduce multi-stress vulnerabilities affecting people's health and well-being, financial situation, mobility, social relations, and access to basic services. And reducing heat vulnerability requires government responses and community level responses, cutting across a number of different sectors, including public health, emergency management, social services, critical infrastructure, and housing. But it also requires an equity-based approach to all decision-making. Our presenters today are going to explore all of these different responses to extreme heat events. The first part of our day until about 2 p.m. will comprise of brief 10-minute presentations, after which we'll go into breakout rooms. Our facilitator, Abi, will guide us throughout the day and keep us on track, and I'm going to pass it on to him right now.
Thank you so much, Z. My name is Abi. I am on the steering committee of the Low Income Energy Network, or LIEN. I'm also a research associate at Efficiency Canada. So just a couple of quick notes about today's presentations and our Q&A and our breakout rooms. So as you know, the topic of the overarching theme for today's conference is protecting vulnerable populations from the impacts of extreme heat. We have a packed agenda. We have some fantastic speakers, and then you have me as a facilitator. So the topics today will include why extreme heat is a rising challenge in Canada. We'll be talking about tracking and data of heat-related deaths in Canada. We will dive into some best practices on maximum heat bylaws and legislation and tenant protections in other jurisdictions around the country and the world, exploring perhaps if air conditioning can be seen as a vital service and a human right. And then towards closer to the end, the presentations will include an opportunity, talking about opportunities for immediate action at all levels of government in Canada. So as we go through these presentations, I'll ask you to think about two things. One is if you have questions for each presenter as they're presenting, I will ask you to put that as it pops up into your head, just put it in the Q&A, and then I, as a facilitator, will collect all these questions. We have a combined Q&A for all presenters I'm going to look at my agenda here, when presentations wrap up. at 1:20 Eastern time. So each presenter has about 10 minutes. We're going to go through these topics. If you have any questions, put them in the Q&A, and I will ask the question on your behalf during the Q&A session to a specific presenter, if that's what you want, or I'll put it out to all the presenters and we can all weigh in. The second thing I want you to think about is to keep an eye to the future. And I want you to reflect as you're listening to these presentations on 3 questions. So number 1, given what you're learning through these presentations and then taking them together, what should our priorities and goals be for the next 3 to 5 years? And given those goals and priorities, what are some challenges or opportunities that we can anticipate and we think are likely to experience or encounter? And then lastly, given that these are the priorities and these are the challenges, these are the opportunities, what are some immediate actions that you as an individual or immediate next step you as an organization are willing to commit to taking to help reduce the impacts of extreme heat on vulnerable populations? So as you're thinking about reflecting on these questions, it'll help us when we come back from the Q&A, get into breakout rooms. There are 4 breakout rooms. Each breakout room, everyone's going to be discussing these same questions, but it'll help us prepare and get most out of interacting with each other and digging deeper into some of these things. So with that said, I will introduce our first speaker for today. We are joined by Joanna Eicham. Joanna is the Managing Director of Climate Resilient Infrastructure and the lead author of the recent report, Intact Centers, Irreversible Extreme Heat, Protecting Canadians and Communities from a Lethal Future. And Joanna is going to talk to us about facing the extreme heat baked into Canada's future. On to you, Joanna.
Thanks so much for that introduction, Abby. I'll just share my screen. Okay, we can see that? Good. Okay, great. So, first of all, I wanted to say thank you for joining this conversation. It's definitely a conversation that we need to be talking about more in Canada, and has only recently emerged really in the kind of spotlight since the heat dome. A lot of people have been working on it for ages, but it's only really kind of filtered through to kind of social conscience just recently. So a very important discussion to have. So I'm going to introduce or kind of try and set the scene a little bit in terms of what the projections are for extreme heat. And these, all of what I'm going to say actually is kind of covered in the publication that Abby just mentioned. So if you want further details, there's already a link to that on the website for the conference. So, and don't hesitate to kind of put questions in the chat as I'm going along. In terms of my background, I'm from the Intact Center on Climate Adaptation, and we focus on extreme heat, flooding, and wildfires as the key risks that Canada is facing. So it's just a part of our work, and in particular, how we can use natural infrastructure as well. It's a big, close to our heart. So without further ado, I'm gonna, it is working. I've divided my presentation into the good news and the bad news. So the bad news is going to be a little bit doom and gloom. And then hopefully I'm going to leave on a positive note on the good news as what we can do about it. And then you can see the link to the publication I just mentioned, which we did not produce alone. It was in tandem with over 65 national experts. So acknowledgements to all the people who did help with that. So in terms of projections for extreme heat, so urban centers are basically the hotspots of global warming. And this was a point that was driven home in the recent IPCC report. And this is because of various different reasons. So our city geometry kind of slows down air circulation. We've replaced surfaces, natural surfaces of vegetation and water. We've replaced with man-made surfaces like asphalt and paving that actually absorb the heat and then re-emit it. So we don't get a cooling overnight, for example, and actually urban areas can become some 10 to 15 degrees hotter in terms of surface temperatures. And particularly at night, this can be a problem because we get these prolonged heat waves. So we don't see the temperature go down overnight. There's no respite. People cannot ventilate their houses and cool. And we also generate heat in our urban areas through usage of cars and our kind of industrial activities. So cities are basically hotter than their surroundings. And we need to remember this urban heat island effect as throughout the presentation, because some of the projections don't actually take into account that urban heat island. So when we look at projections for extreme heat across Canada, we see there's basically 3 areas that are really most exposed. This is not to say that they're definitely more vulnerable, but this is where we're expecting the hotter temperatures. So we can look at the valleys and lower areas of BC. We can look at the prairie communities, particularly bordering the US. And then from the Great Lakes kind of down the St. Lawrence River Valley. And unfortunately, that is basically touches the southern portion of Ontario, which is probably where a lot of people are coming from today. So that is, and if you want to explore this data, this is available all publicly and kind of user-friendly format at climateatlas.ca. And I would recommend you go and have a look at it yourself, particularly if you want to find out what the projections are for where you live. It's very easily accessible. So as part of the report, we were interested in where in Canada is the most exposed to extreme heat. Again, this doesn't take into account urban heat island effects, so actually some of the temperatures could be even higher. So we looked at basically the metropolitan areas that are recognized by Statistics Canada as kind of census metropolitan areas, they're actually called. So basically our cities, our major urban areas. And so about 70% of our population live in these areas. So this is like a huge part of our population that is affected. So we looked at 3 indicators, looking at very hot days over 30 degrees. We looked at the maximum temperature and we looked at heat wave length. And we basically ranked the different urban areas. And you can see that on this graphic, there's the orange kind of triangle indicates the cities that are in Ontario. So you can see that there are a lot of cities that are kind of in the top 10. This is an example of very hot days. A lot of the cities that are feature in the top 10 or when we rank them for those indicators are actually in Ontario. So this is a serious issue for Ontarians. As an overview, you can see in this map is basically the different urban areas that were ranked in terms of the ones in bold are those cities areas. And we also looked at some smaller communities that are also facing similar risks. So this is not all of them, but it's just to give an idea of the distribution of places that are exposed in Canada. And the red circles are basically population. So you can see that specifically in this area around Windsor, these most southerly Ontarian areas, we have a lot of population. That big red circle is obviously Toronto. We have a lot of people in potentially exposed areas. So that's the bad news. I'm going to move on to the good news. The good news is that heat-related illness and fatalities are avoidable through appropriate adaptation and emergency response and kind of collective action. So in basically our concern in the report was to present solutions as what we can do as individuals, as property owners or managers, and as communities to reduce impacts on people. And we divided the actions. We did a fairly comprehensive kind of review of different actions that had already been kind of proposed in different fields like architecture, health. A lot of people contributed. And you can break them down into kind of behavioral and planning. So we call those non-structural because they're not actually building something. Green infrastructure, so looking at working with nature, and grey infrastructure, which is more kind of traditional building and public infrastructure where it's more grey infrastructure, concrete, you could think of not vegetation. So there's a lot of actions. I'm not going to go through all of them. They're all in the report. There's 35 different actions. But potential actions for residents obviously include things like, having check-ins with your neighbors, or figuring out who in your family needs to be supported, and helping them to adapt. Behavioral things like getting heat warnings, learning how to best ventilate your house in the evening, modifying how you're using your building. If there's if you're lucky enough to have a basement, using that for sleeping, things like that. Trying not to generate heat in the building, choosing things like energy efficient appliances that don't produce so much heat, not using the oven, that kind of thing. So there's things that we can do on the behavioral side. Green infrastructure, looking at how we can plant trees to actually reduce heating of buildings. So the shade that trees provide to lower rise buildings can be significant. And expanding vegetation cover, also potentially green roofs or green walls as well for people who are have the facility to do that. And we do recognize that some of these actions are not available to tenants. So there's a kind of a whole bag of things to do, but obviously we know that not everybody can do these things. Then there's a whole rake of gray infrastructure solutions, which are a lot of them similar to what you have for energy efficiency. So looking at insulation, airtightness, making sure that your windows are not letting through a lot of heat. You have low heat gain glazing, for example. And obviously ceiling fans or portable fans and air conditioning or heat pumps also feature as active cooling measures. That just gives a bit of an overview. For property owners and managers, there's a similar actions, obviously, but additional kind of things is kind of how to plan with tenants, how to support vulnerable tenants in taking their own action, but also how to kind of identify them and making sure they're not in danger during a heat wave event. And other things like backup power and kind of having kind of if there's a power outage, having electricity to pump water and supply, keep some air conditioning going in the building as a minimum, so that people have access even if their own air conditioner is not working, if they have air conditioning. Challenges are our older infrastructure is not designed necessarily for extreme heat. We have higher temperatures on higher floors in apartment buildings, so that can be a challenge. Limited opportunity for natural ventilation, because if you're only facing one window and the whole pressure differences in the hallways, basically if you open the window, the air does not go out in exchange, and a reliance on the power supply. So, if we have outages during a heat wave event, then things could be much worse even than they were last summer. So it gives an overview of some of the actions that we can take. If you want to find out more, you can check out the report, and I will be facilitating some of the breakout group work as well. I think one of the things that we try to stress is we know that these actions are not available to everybody, and it's how to support the most vulnerable people in taking the action they can, but also providing them support so that we don't have more fatalities and illnesses that are basically avoidable due to extreme heat. Thanks very much.
Join me in thanking Joanna for her fantastic presentation. If you have any questions for Joanna, now would be the time to pop them in the chat. Thank you very much, Joanna. We will now be moving on to the next speaker on the agenda, Professor Gordon Mcqueen, who has been with Western University since 2000, and his contributions in service to advancing weather, climate, and air quality sciences has received wide recognition both in Canada and internationally, including being awarded the Order of Canada and also the Order of Ontario. Professor Gordon Mcqueen will talk to us about building resilient communities. Over to you, Professor Gordon.
Thank you very much. And thanks to Joanna for a very good presentation. She's covered much of what I'm going to talk about as well, so I'll be just adding to it. So let me just say that this is an important thing to address, this whole issue of dealing with the issues of climate change and how it affects our communities. So what I'm going to talk about is building climate resilient communities as an overall issue, and how we can work together across these issues. I'll focus on heat, but also, of course, bring up the other issues. So let me just give some background. First of all, to note that in a global context, Canada is warming at nearly twice the global rate. So when they talk about 1.2 degrees C warming, or that's happened already globally, that means in Canada, we're averaging probably well over 2 degrees C warming, and Northern Canada is warming at 3 to 4 times that. We're also seeing the number of hazardous events going up significantly, fires, floods, etc., heat, and these are insured losses, so that the impacts of heat on people and their health don't usually show up in these numbers. So what we got to recognize is that the extreme events that we're experiencing already, such as Hurricane Fiona a few days ago, and now Hurricane Ian on its way, these things are projected to intensify in the future, more of them, more often. So just to say, back on the heat waves issue, just very quickly, since we've already had Joanna talk about this, to say there have been some big events in the past. The European heat wave back in the 2003, estimated 55,000 people died. The Russian heat wave, a couple of years later, 70,000 people died. And interestingly, although you hear mostly about floods and hurricanes in the United States, that the US data shows that the biggest single event category that causes the largest number of annual deaths in the United States is heat. And in Canada, this is just a different version of what Joanna has shown, just to say that where you used to get an event, say here in Toronto area, maybe 10 times a year with low emissions. Anyway, by the end of the century, we'll be up to 40 if we do something on reducing emissions, but we could be well over 70 events per year. So we need to account for that. So what we've been trying to do is bring together a community of scientists across disciplines to deal with what we call this building climate resilient communities across the issues. The impacts and adaptation and resilience strategies across heat environment communities led by Professor Jamie Voot, construction codes across all the issues of wind, high hail, wildfire, urban flooding led by Professor Greg Kopp, building climate resilience in Indigenous communities, very important. We had a group of Indigenous, well, Brendan isn't an Indigenous person, but this group and these here really work together to produce the analysis there. And very importantly, the climate change impacts on human health, the economics and climate adaptation, barriers to adaptation, how do cities adapt to wildfires. And if you want to get it, this report is available to open to anyone. It's about 50 pages long, and then you can just download it from here on your website. So going back to the more theory of things, just to say that there's, from the United Nations Disaster Research Resistance Program, this notes that there is no such thing as a natural disaster, only natural hazards. And the things that make them disasters are the combination of choices of where we inhabit, what we build, what research we do, and the combination of hazard exposure and vulnerability lead to the death, loss, and damages. So the key things that we have to work on is reducing exposure and vulnerability of these kind of properties, our homes, our properties, where we live, etc. And for that, we need to take actions across this to reduce exposure, vulnerability, and we need governments at all levels working together with our neighbors, in this case, other countries, other provinces, other cities, to develop policies and actions to reduce exposure and vulnerability in ways that we can really support local action. Just summing lessons we've learned from horrific past events. The Pine Lake tornado in the July 2000 tore across a community here of Green Acres Campground in Pine Lake, Alberta, killing 12 people, injuring critically more than 100 others. And I went to visit this site a couple of years after the event to see what they'd done to build resilience. And all they'd done is put up a little tombstone here with the names of the dozen people who were killed on it, one of whom was a baby child who was torn out of her mother's arms as she ran desperately trying to find some place for safety, and there wasn't any place, and the child was killed. And they haven't done anything on this. So we need to look at these things and say, well, why do people, as we say, organizations and government hear the warnings of severe weather? And if so, what do they do to respond? And how can we take action so we increase the active and effective responses? Here, this was on CBC News, this tornado coming here. And this guy was out mowing his lawn with the tornado coming up behind him, and his wife took pictures of it because that got them on the CBC National News. And I say, well, why on earth would you do that? And this is a cartoon someone sent me on that back. So what we can say is that from our study of climate resilient communities, that some communities in Canada have prepared high-level adaptation plans, but few have actually detailed implementation strategies, and emphasize that, with established funding to do that. Many actions to build climate resilient communities in Canada were unplanned, and they take place after there's a terrible event. And that way of doing it continues. The Indigenous communities are leading in climate change adaptation, a lot of work being done. And the expert community overall has provided the tools to develop and implement plans. And the real problem is that local governments lack funding, and they lack the guidance from senior governments to plan to be resilient. We need to take action so that we need to work across borders. We get these problems of governance. And when you deal with heat, but also particularly say a flood or a tornado, it passes over the borders internationally and between provinces. And we got to have multi-level governance and sectors of society working together to address these issues. So just some examples, and this really just reinforces what Joanna's already said, that how can cities adapt? There's a network of C40 cities that include Toronto, Montreal, Vancouver, and many others who are working together. And for example, in dealing with extreme heat, nature-based solutions of putting in issues like trees and cool surfaces on the top of buildings in order to reduce the heat, just as examples. Joanna talked about even more of them. The idea of inland flooding, we can put in issues that deal with the water coming through and where things that we have drainage basins and flood management systems. For coastal cities, you've got the additional problems as we're seeing with Hurricane Ian and Hurricane Fiona. Terrible storm surges causing huge water loss, impacting communities, drought, the other side of being, and wildfires. And we need with wildfires, for example, when the trees we put in to reduce the heat island effect, we need to make sure that they're not right next to the buildings such that they could carry a fire across into this and create fire situations. So we have done studies, the Institute for Catastrophic Loss Reduction that I'm part of, and particularly Sophie Guibault and Paul Kovacs with some other co-authors, have studied and looked at through a report at how cities adapt to extreme heat and celebrating the local leadership where they've taken action. And what we saw was common in all this is they deal with the issues of alert. So we need to be able to identify the heat health risks and identify the actions that can be taken place. We need community response plans. How do we deal outreach to stakeholders, for example? Issues of communications, increase awareness, education, alerts, and an evaluation plan so that we keep updating these strategies as the situation changes, gets worse, or when we take actions to make it less hazardous. So that's community mobilization engagement. And when we looked at it, where were some of the big lessons learned? I'll just focus on some of the ones on preventing actions in prevention to reduce the risk of loss. Assessments of heat health vulnerability need to be done community by community because they vary across them. actions to encourage the planting and care of shade trees, installation of cool and green roofs, and requirements for promoting passive cooling and construction of new buildings, long-term urban planning systems, strategies, etc. And as finally lessons learned, we need national and provincial leadership support for local preparedness, bringing together. There is also in this a whole series of things that you can also happen. And I want to emphasize, we need to deal with heat, but we also need to do it in a way that works together with our actions to reduce the effects of flooding, the effects of tornadoes, wildfires, etc. And the Institute for Catastrophic Loss Reduction has put on its website a whole series of reports on basement flooding, wildfires, severe wind. And these are written for people in communities, all you people listening and others. These are meant for you to read about, including things that aren't really climate related, but earthquakes, for example, so that we can deal with earthquakes, wildfires, etc. And so I just want to say in concluding that climate change is an issue of intergenerational, national, and international equity and ethics. We need to reduce the emissions. There's lots of talk about that, even though Canada is not really doing it very well. And we need to adapt for all, for now and in the future. So we need to do this as these are students in London, Ontario, marching, fight climate change or die frying. Unite behind the science, save the earth. As this parent, I asked him if I could take a picture of these young children with their mom and dad, and they said, yes, please do. And here it is. As I say, unite behind the fire, help the earth, save the planet. And with that, we need to go from standing in front of an oncoming tsunami and reading a citation. We need to go from reading citations and planning to action to make a difference. And with that, I'd like to say is I want to thank you all for your actions now and in the future, and I'll stop here. Thank you.
Thank you very much, Professor Gordon. And I'm already, just based on the two presentations, I'm already seeing some clear themes emerging. And this isn't an attempt at a summary by any means, but just things that stood out to me from the two presentations we've had so far. We're talking about there's good news and bad news. And the good news is that we can take action. But in that good news is also a bit of bad news, in that what Gordon pointed out is that we may have the tools for taking action, but the impacts are being felt globally, but also immediately right now in our local communities, and that local governments lack the leadership and action to implement some of these best practice recommendations. And we need to go away from these adaptation plans into specifying the details on how we would actually help communities, especially vulnerable communities, deal with these challenges, and that we need to be working across governments to put these practices into place. Thank you both for setting us up for success. Our next presentation will segue very nicely with what we've learned so far. It's from Dr. Samantha Green, who is a family physician at St. Michael's Hospital. She is an assistant professor at the University of Toronto and also sits on the board of directors for Canadian Association of Physicians for the Environment. Her presentation today is about integrating social accountability for climate change and health through education, advocacy, and health systems improvements. Over to you, Dr. Green.
Great. Thanks so much for having me. Yeah, I think there is a nice segue from the last two presentations. Just going to shift perspective a little bit, but speak to similar topics. So last winter, ahead of the COP26 climate change meeting, more than 200 health journals worldwide came together to call for urgent action on climate to keep average global temperature increases below 1.5 degrees, halt the destruction of nature, and protect health. And at the time, the British Medical Journal, the BMJ, said it was the first time so many publications had come together to make the same statement, which really reflected the severity of the problem. And that's because climate change is the biggest threat to health of the 21st century. This was first stated in the Lancet in 2009 and has since been reiterated by the WHO and indeed the Secretary General of the UN most recently. And how does climate change affect health? Well, we know that health is determined by more than just healthcare. This is an image that was first published in 2009 by the Canadian Medical Association, group of doctors. As I'm sure you all understand in your day-to-day work, about half of an individual's health is determined by the social determinants of health. Things like income, disability, gender, housing. About 25% is what I do as a healthcare provider in our healthcare system. 15% is biology. And you can see here, just 10% was thought to be attributable to the environment. Now, I would argue that's probably growing with the growing climate emergency. And I would also argue that, unfortunately, the COVID-19 pandemic has actually demonstrated this quite well. Ecological determinants of health or environmental determinants of health are foundational. And so without a stable planet, without clean air, without clean drinking water, nothing else matters with respect to someone's health and with respect to population health. And, you know, the COVID-19 pandemic is really a different planetary health crisis, because we know, there's no direct link that's been proven between climate change and the COVID-19 pandemic, but certainly it was a planetary health issue where, you know, there was a jump from an animal vector to a human, probably related to loss of biodiversity and loss of habitat. So how does climate change affect health? This is a very complex, messy diagram showing the many interdependent and complex health effects, and I'm not going to go through it now, but it was published in the 2019 Lancet Countdown on Health and Climate Change. That's actually a publication that is put out annually ahead of the annual climate change meeting, so November, December, in the Lancet. And it's an update on the status of health and climate change globally. And then there are country-specific reports that get published as well. So there is a Canadian report for every year for the last 5 or 10 years, reporting on the status of health and climate change here in Canada. And this is from the 2019 Lancet Countdown report on Canada. So, I mean, in addition to heat, which we are focused on today, climate change also results in more extreme weather events like hurricanes, which, you know, we just saw this week, floods, wildfires, and those cause direct physical injury, significant mental health effects. And then wildfires also cause poor air quality, which can exacerbate respiratory diseases and cardiovascular disease. And climate change leads to a change in vector-borne disease. So right now we see far more Lyme disease in Canada than we ever have. And globally, there's an increase in malaria, West Nile virus, dengue, and Zika. And then the biggest two impacts of climate change on health are actually the indirect impacts of displacement and unfortunately, food insecurity. And globally, food insecurity is thought to be the biggest health impact of climate change. But we're here today to talk about heat. So how does heat affect health? So there's direct heat-related illness, so heat exhaustion, and then heat stroke, which is often deadly, has about a 50% mortality rate in classic heat stroke. But there are other impacts on health. So extreme heat can exacerbate chronic conditions, including asthma, heart disease, diabetes, kidney disease, and a host of mental illness, including an increase in suicidality. So there's actually been demonstrated a correlation between temperature and number of suicide attempts. And there's also an increase in violence. And I mean, I'm sure we all remember the heat dome that hit British Columbia, where between 500 and 700 people died in just 5 days. And the majority of those people were isolated seniors over the age of 70. And during extreme heat, people can also get burned by extremely hot surfaces, especially those in direct sunlight, such as metal surfaces in children's playgrounds. And then there's also an increase in ground level air pollution because with warmer temperatures, and that can exacerbate both respiratory and respiratory diseases and heart disease. And extreme heat increases the demand for healthcare, emergency, and social services. So for example, during that BC heat dome in 2021, Vancouver Fire Rescue Services reported a 3-fold increase in call volume and waits of 11 hours for ambulances. And during the 2010 heat wave in Quebec, there were 3,400 excess admissions to emergency departments than would have otherwise occurred. And many common medications, including blood pressure pills, antidepressants, allergy medications, affect the body's ability to regulate temperature and increase the risk of heat-related illness, including heat stroke, which, as I mentioned, is often deadly. And we know that there are certain populations who are more at risk than others. So those with increased exposure to extreme heat, which would include people who work in the heat, both indoors and outdoors, and people living in urban heat islands, which we already heard about. For example, where I work in the downtown east in Toronto, St. Jamestown, people who live in St. Jamestown are much more exposed and at risk. People experiencing homelessness as well. People living in housing that is poorly adapted to the heat, including prisons and higher floors in apartment buildings and housing without adequate ventilation. Then there are those who are with increased sensitivity to the heat. So older adults, infants, pregnant women, those with chronic conditions, those with mental illness, people who use drugs and alcohol, and then people taking certain medications, which I already mentioned. And then there's also those with limited access to resources or information, including people experiencing homelessness, people with language barriers, and people living in racialized and poor communities. So I've kind of outlined the health impacts of climate change generally and of heat specifically. And as a doctor, I'm quite concerned, and there is a growing concern about the climate crisis as a health crisis. So there are a number of us engaged in several actions around the climate health emergency, which is what I've taken to calling it. So first is mitigation. So many of us are working to reduce emissions from within the health sector itself. The health sector contributes 4.6% of Canada's total emissions, which is on par with the aviation sector here in Canada. And if the global healthcare sector were a country, it would be the 5th largest emitter on the planet. So, and actually here in Canada, we're particularly carbon intensive in our health system. We're the 2nd most carbon intensive health system in the world after the United States. So we have a lot of work to do within the health system to reduce the harm that we're actually causing by providing healthcare. We're also engaged in doing this kind of advocacy that I'm doing here today, really speaking out about climate change as a health issue, because I think the general public probably doesn't really think of climate change as a health issue, but as you can see, it really is. And climate communication, this is a research from climate communication scientist Edward Maybach. And what he has said is that we need simple, clear messages repeated often by a variety of trusted voices to affect change on the climate crisis. And you can see here that primary care doctor, which is what I am, are the most trusted to speak out about climate change. More so even than family and friends, certainly government, even local public health departments, I'm sorry. So certainly there's work for us to do in leading this and leading in the adaptation space as well. And this is just demonstrating that, again, people really in Canada look to the healthcare system as an important part of Canadian identity. And so there's power in that. And if we can speak out about this issue, then I think people will pay more attention. So we're speaking out for urgent climate action to reduce emissions, for urgent adaptation and resilience. And we're also speaking out about interventions that have immediate health benefits. So including, and this, sorry, I'll just point out that this is the editor of The Lancet calling on all health professionals to engage in nonviolent social protest to protect people from climate change. So there is this growing movement for physicians and other health professionals to do this advocacy work. And just speaking to health co-benefits, I won't get into it in too much detail, but we're really speaking out for example, in favor of active transportation and active transportation infrastructure, because people benefit directly from engaging in more active transportation. And then, of course, we're also reducing emissions. And likewise, we're speaking out for nature-based solutions, more green space, because actually there's great deal of evidence showing that more time spent in nature is better for health. And then likewise, we are advocating around plant-rich diets because plant-rich diets are much better for health. They reduce heart disease, diabetes, obesity, and of course are better for the planet as well. So there's a role for physicians and health professionals to speak up about actions that will reduce emissions at the same time as leading to immediate health benefits. And likewise, by reducing emissions immediately, we can have immediate health gains from the reduction in air pollution and air pollution related illness. And then finally, sorry, I know I'm running out of time. My last section, my last couple of slides. So we are also working on adaptation, and I just wanted to provide an example of I've been doing some education of health professionals around extreme heat and being able to recognize heat-related illness. But then in my family health team, and this is, I promise, my last couple slides, sorry, we actually have done some patient-facing work. So we've been doing education of our patients. We put on a webinar on extreme heat and how to protect oneself from the heat, together with some community-based organizations. And we had a couple of hundred of our patients attend that webinar, and we spoke about how to protect oneself, how to prepare and manage extreme heat, and we addressed some of these questions that we had received from our patients who had registered. So that's it.
Thank you so much, Dr. Green. You've helped draw a closer link between climate and health, and especially, particularly for me, what stood out was links between adverse effects of climate on vulnerable populations. And the next presentation will lead very well into that. We have Jane Matus, who's a staff lawyer and an institutional advocate at the Advocacy Center for the Elderly. She is a distinguished fellow of the Canadian Center for Elder Law Studies, and a published author, a regular public speaker, and a frequent media contributor on long-term care issues. Jane will be talking about the impact of extreme heat on seniors and the problem with tracking heat-related deaths and data in Ontario. Take it away, Jane. Thank you.
Thank you. Thank you. Getting my timer here so that I can keep in time here. So I'm probably the least knowledgeable about climate change and all about, and environmental issues. That's not something we deal with at our clinic sort of on a day-to-day basis, but we certainly deal with it on a practical basis. And we are a clinic for seniors in the city of Toronto. Just a little bit of information about our office. So I'm going to be talking about sort of three general areas. So seniors in the community, and I would say it's seniors and vulnerable people. Obviously, we deal with seniors, seniors in long-term care homes, and there's been changes there, and then the work of the coalition. I'll talk at the end. So when seniors in the community, there's different issues when it comes to heat-related issues and global warming. So somebody who owns their own home, of course, is responsible for installing, for example, their own air conditioning systems. Part of the problem is that global warming has increased the heat. And so when people bought their homes 50, 60 years ago, they may have deemed air conditioning not to be necessary when it was purchased, but now they may require it. The problem being is that it may now be cost prohibitive if they're on a fixed income. There have been sporadic government programs, but none specific to seniors that I'm aware of, and it still can be cost prohibitive. And they're vulnerable to scams. When they have these government programs, people show up at people's doors and try to sell them things. Even when there's no government programs, they do that. So people in the community, especially seniors and vulnerable people, are vulnerable to these scams. There are cooling centers in many large urban areas, but that doesn't mean that a person can get to them. So they may not be able to have transportation. They may not be able to go outside in the heat. They may have ill health, not be able to go outside at all, be housebound. So these cooling centers, while helpful, may not actually be helpful to the people who require them the most. Retirement homes, those are residential tenancies that are under the Residential Tenancies Act and the Retirement Homes Act. They're not required by law to have air conditioning, but because it's contractual and they're usually very high end, they're very likely to have air conditioning actually. Some of the cheaper homes will not, but the more expensive one definitely will, because you're just paying $5,000 to $6,000 a month, you're going to probably require air conditioning. They are getting to be more and more treated as long-term care homes. So some of the cheaper ones potentially could have legislation towards them. Otherwise, they're the same as any other rental unit. And again, ill health, a lot of them are unable to go outside. Many have illegal locked units or don't allow people to leave, which is illegal, but they do it anyway. And so maybe not able to access cooling centers. We have other types of congregate living, which may be covered by Residential Tenancies Act. Others may not. Some may be operating in a gray area of law. No requirements for air conditioning in those. So we have sort of a mixed bag when it comes to the different kinds of community care. Whoops, I put that in the wrong place. It's up to the operator to decide when to whether to install air conditioning. There's no legal requirements, so we'll hear a bit about municipal bylaws, I think, in the next session. And the same issues with access to cooling centers. Long-term care homes were governed by the Long-Term Care Homes Act until April 11th of this year, and after that, the Fixing Long-Term Care Act. One of the major changes in the Fixing Long-Term Care Act was the requirement of air conditioning on June 22nd, unless they met other criteria. And just to know that there's about 79,000 people in long-term care, probably a little less now since those stats, because of some changes in the rooms, but around that number. When the Long-Term Care Homes Act was enacted in 2010, there was no requirement for air conditioning, no maximum temperature. If they didn't have central air, they had to have a cooling area for every 40 residents. There was a 2015 long-term care home design manual created. It didn't require air conditioning. It required room air tempering, but didn't specify any temperatures. And again, common areas, but no temperatures were specified. And at ACE, every year we would get calls from shocked relatives saying, oh my God, there's no air conditioning in this home. I have been in homes in bedrooms during heat waves where I could not stand to be in that room, and I don't know how anybody could actually live in those rooms. When you talk to organizations and homes, they would tell you, oh, well, you know, seniors don't feel the heat. They're always cold. We don't need it, even though the rooms were sweltering. New builds that were beginning didn't require air conditioning at all. A lot of the time, municipal, not-for-profit, or charitable might install them as they raise money elsewhere. But for profits, there wasn't any reason for them to if it wasn't required. So they weren't building with those air conditioning units. We advocated with the ministry unsuccessfully. And, you know, there was I've done lots of media. Here's a couple of articles that I was in talking in 2018 and 2020 prior to the whole Doug Ford thing about heat. Of course, there was a big focus on long-term care in 2020 when all of a sudden the premier discovered there was no air conditioning in long-term care rooms, and he said he'd like to stick the licensees in the rooms for 24 hours at 30 degrees heat and see how they like it. And he said he was going to make it mandatory. There had been some funding announced in 2020 in March, so it was coming, but we still didn't see any changes. Homes that were being built were not being required to have air conditioning. They were just going to the 2015 standards. And in fact, during the pandemic, people were not allowed to use flare units, fans and stuff in rooms by the public health departments. We did have some changes in April 21 to the regulations around some prevention and some temperature measurement, and they were actually having to look at these issues. And then we had the new legislation, which required homes to have air conditioning unless either the structure couldn't support it, so the electrical structure or the building structure in old homes, or if they had some issues around delays due to, you know, some of the supply chain issues. As of July 19th, 2022, 537 of 627 homes were fully air conditioned. And the ministry included this information on its long-term care home finder. And since that time, 2 homes have been found to be non-compliant, both for not-for-profit. Interestingly, they've been fined $1,100 each. They're both appealing the fines, and the reasons for their non-compliance, they say, are either that they've complied or the cost of complying is too expensive. So there's been a sort of lack, and we've heard, I think, a little bit in the last session about the lack of the issues and the bringing it to the government's attention. They only discover things at certain time. Took a long time to have any real change. We heard about different heat waves in Europe, different places, BC. In the summer of 2018, Quebec reported 70 people dying in a heat wave. Ontario reported a possible of 3, but never had a definitive number, one being potentially a child left in an overheated car. The coroner's office does not look at heat-related deaths. They look at it as concurrent, oh, well, they actually died of heart disease or something else, and don't look at whether it was hastened. Reporting in from long-term care homes around that is there's no, it's self-reporting, and death due to heat is not one of those things. We did request the regional coroner who looks at the geriatric and long-term care issues about deaths, and he had no reports or information. So in 2020, there was a coalition from CELA, LIEN, ACTO, and ACE put together. We wrote to the chief coroner asking to track heat-related deaths in Ontario due to the climate crisis and effect on vulnerable populations. Weren't receptive initially. We met with the Ministry of the Solicitor General in the beginning of 2022. We pointed to different places that had examples of tracking by the coroner's offices. In the summer of 2022, we sent a new briefing note to the Chief Coroner of Ontario, and at that time he did agree to that there was further analysis merited, asked their data and analytics group to evaluate data to determine whether or not this is something that should be followed up, and so that we could understand, the potential association of deaths with extreme heat. And the coroner indicated that once that work was done, they would follow up with the coalition. And I'm done. And I did it I did all my slides. You didn't think I was going to do it. There we go.
I never doubted you for one single moment. Thank you so much for your presentation, Jane, especially on the impacts and the challenges of tracking heat-related death. That's news to me, as I imagine it is for a lot of people. So thank you for your work. So next, we're going to segue into 2 presentations. Both of them will talk about what are immediate actions that different levels of government can take. First, we have Megan Kenley and Jacqueline Wilson. Megan is a second-year law student at Western University who recently completed a summer internship at the Canadian Environmental Law Association, which is also known colloquially as CELA. And Jacqueline Wilson is also with CELA, and she specializes in climate change, energy, and land use planning, representing clients at all levels of Ontario and federal courts. Megan and Jacqueline are going to talk about recommendations for municipalities on extreme heat and rental housing. Go ahead.
Great, happy to be here. Thanks for that introduction. So I'll just hop right in. So over the summer, Jackie and I worked on ongoing law reform initiatives. We wrote several legal recommendations on how to address climate change from an equity perspective. And after this presentation, you're more than welcome to go and see those on CELA's website and read up on those as well. So the first one I'll be discussing today is a legal memorandum on municipal powers. This was written to brief municipalities on their broad jurisdiction to tackle environmental concerns. This broad jurisdiction comes from both the jurisprudence and from provincial legislation. So the most probably famous case on this issue comes from the Supreme Court of Canada in 2001 called Spraytech and Hudson. The Supreme Court of Canada held that municipalities have general welfare powers that authorize the enactment of bylaws aimed at furthering goals such as public health and safety. Additionally, the Supreme Court held that there is a general presumption that bylaws passed by municipalities are valid, and specifically stated that courts should do their best to refrain from substituting their own views on what's in the best interest for the citizens in that municipality. Additionally, the Supreme Court stated that municipalities can enhance protection provided by other levels of government, and this includes environmental protection. The Supreme Court echoed a statement by Justice Laforêt in a separate decision stating that environmental protection is a major challenge of our time. It's an international problem and one that requires action by all levels of government. And additionally, the Supreme Court provided that provincial legislation in a field does not oust municipal prerogatives to regulate on that same subject matter, barring an operational conflict where one enactment would say yes and the other enactment would say no. This is impossibility of dual compliance, and in those situations, the municipal bylaw will be held to be ultra vires or out of their jurisdiction and will be accordingly struck down. Another case discussed in this memo is Shell Canada Products and Vancouver City. It's also a Supreme Court of Canada decision from 1994. And in this case, Justice Mcqueen, as she then was, provided that municipalities must be given broad jurisdiction to make local decisions reflecting local values. This broad discretion increases efficiency of municipal bodies, as well as avoids the costs and uncertainties associated with excessive litigation. As I mentioned, broad jurisdiction to tackle environmental concerns also comes from provincial legislation, including the Municipal Act 2001, the Health Protection and Promotion Act, and the Planning Act, which are all pieces of Ontario legislation. In Section 8.1 of the Municipal Act, it states that municipal powers in that act and other acts must be interpreted broadly. And additionally, just to give one more example, in Section 10.2 of the Municipal Act, it states that municipalities are authorized to regulate the economic, social, and environmental well-being of the municipality, and that includes respecting climate change. So all of this is to say that municipalities have broad jurisdiction to regulate environmental concerns, pass bylaws on their own, as well as enhance protection by other levels of government. The next recommendation I'll be talking about today is on green roofs. So this recommendation first discusses the benefits of green roofs, which have already been touched on in the other sessions, but these include stormwater management, including reduced sewer overflow and erosion control, as well as reduced energy usage. Green roofs can reduce heat penetration in the summer and reduce heat escape in the winter, as well as green roofs reduce the urban heat island effect through evapotranspiration. And finally, green roofs can sequester pollutants, and this reduces air pollution. This recommendation includes a model green roof bylaw. Authority is granted from Section 97.1 of the Municipal Act 2001, again, Ontario's legislation, that allows municipalities to require the construction of green roofs or alternative roof surfaces. And so this bylaw requires construction of green roofs on new industrial, commercial, and residential buildings of a minimum gross floor area of over 2,000 meters squared, as well as requiring retrofits of these buildings, older buildings, within a time limit of 5 years of the enactment of the bylaw. If for some reason an older building cannot be retrofitted because it cannot conform with the Ontario Building Code, then a payment must be made to the city's Eco Roof Incentive Program. And this recommendation also includes various other requirements from the Ontario Building Code relevant to the construction of green roofs. Finally, I'll be discussing our urban cover recommendation. So again, this one discusses the benefits of urban cover, which largely mirror those of green roofs. So improvements in air quality due to the sequestration of pollutants, as well as the reduction of the urban heat island effect due to evapotranspiration. As well, of course, trees provide shade, which protects us against harmful UV rays. One interesting note is that we found that urban cover actually declines with socioeconomic class. So in neighborhoods that were higher, in neighborhoods that had higher socioeconomic class, there was more prevalence of green infrastructure, and green infrastructure declined in areas that were poorer and more multicultural. Along with a series of other recommendations, SELA is recommending that municipalities implement a tree equity approach, which is a metric that helps cities assess how well it's providing equitable tree cover for all. A lower score indicates a greater priority for closing the tree canopy gap in that neighborhood, a greater priority for implementing green infrastructure, and a higher score implements that the neighborhood has acceptable tree equity and that green infrastructure should be prioritized in other neighborhoods. And I will now pass it on to Jackie.
Thanks very much, Megan. I'm going to be speaking about maximum temperatures in rental units. We were pleased to see the Ontario Human Rights Commission issue a statement on this issue quite recently, and we agree with them on viewing this issue through the lens of human rights. It cannot be that there are people, because of their income or disabilities or age, that are at risk of death, of dying in their place of living from climate impacts. And so we need to respond and find solutions that deal with the issue with the appropriate urgency. The Ontario Human Rights Commission statement also found that the Residential Tenancies Act should recognize cooling as a vital service under that act, with which we would agree. In thinking about the issue of cooling and rental apartments, we were struck by the starkness of the BC report on deaths from the heat dome in 2021 and the similarity of the findings when Quebec looked at the issue after the heat wave in 2018. And BC's report found that 90% of the 619 approximately people who died were over 60 years old. 91% of the people who died had been registered with at least one chronic disease registry. Deaths were higher in socially and materially deprived neighborhoods. Poor quality housing, homelessness, and overall deprivation were risk factors. And 98% of the deaths occurred indoors, where people didn't have adequate cooling. In Quebec, the findings were very similar. Risk factors for death were age, people who were socially isolated, people with chronic diseases or psychotic disorders. The majority of people who died lived in an urban heat island, and 8 of the 53 people who died in Montreal during that time lived in a senior's home. And again, most or maybe all did not have access to air conditioning. In light of this profile of the people affected, it's CELA's recommendation to move away from public cooling areas as the main policy response, which are not a good solution for the people most affected, for elderly people with disabilities and people who are socially isolated. And any response needs to be in the apartment, in situ. So CELA has recommended a maximum heat bylaw be passed by municipalities in Ontario in recognition that air conditioning or active cooling cannot be seen as a luxury anymore. And the full model bylaw is available on our website. The wording on this slide looks at a few of the key issues in a model bylaw. It looks at setting a maximum temperature of 26 degrees Celsius. It explains how to test the temperature and requires the landlord to create the infrastructure to put it in place for cooling, and sets a deadline for 1 year from passing the bylaw. I'm going to end there because that's our 10 minutes, but I would be very pleased to discuss this recommendation and the other ones further. Thanks very much.
Thank you very much, Meg and Jackie, for your presentation. There are some questions in the Q&A, which we will get to in a minute. Next up on the list is me, as it turns out. So I will start my presentation and then start sharing my screen. It is, of course, a little awkward doing this while you're also presenting. So if I go over time, I hope someone else on the call will crack the whip and let me know my time is up. So I will talk about, building on what we just heard, I will talk about a research report that we're working on, but what you're seeing today is a bit of a sneak peek into the work that we're doing, primarily looking at energy efficiency and tenant rights, and how we should, advancing both actually leads to positive outcomes, especially for vulnerable and low-income households. So the report is scheduled to come out in closer to the end of December, but this is sneak a preview that my team at Efficiency Canada hasn't even seen this yet. So you folks on the call are the first people on the planet to see this. So the road to 2050 is a monumental challenge, especially considering what we heard today. In order to get to our 2050 net zero climate goals, the road to getting there has to go through every single building. And it's not just net zero, but Canada has also federally committed to affordable housing as a human right, and affordable, appropriate, and secure housing is a part of it. So the challenge that we're faced with is how do we retrofit a vast majority of Canada's buildings to meet our net zero goals while also doing it in a way that avoids a disruption and evictions and displacement of low-income households, especially rental households. And this challenge is even more growing more significant because, and this is 2021 census data that just came out last week, the housing data, is that the rental population and the number of rental dwellings in Canada is increasing. So 34% of Canada, which is a peak, 34% of dwellings in Canada are now renters. The growth in rental households is the rate of growth of rental households is nearly twice as much as rate of growth of homeowners, and a significant portion of new housing that's being built in the last 5 to 10 years is largely renters, and significant portion of them are millennials, newcomers, and low-income households. So as rental population grows, how do we tackle the challenge of improving housing conditions, improving energy efficiency, while also protecting tenants? So these are our policy goals that we're working on as to begin with. So what we want are strong energy efficiency policies, which will induce the demand for retrofits and upgrading housing among landlords who often have control over the property and have control over making structural upgrades to the property and retrofitting them to meet housing conditions and housing standards, and doing that in a way that also maximizes the benefits so that this doesn't end up being a subsidy for landlords, but the benefits of improving energy efficiency in households accrues primarily to tenants and minimizes the disruptions for them, before the retrofit, during the retrofit, and a lot of deep retrofits especially require significant in-suite measures. So how do you protect tenants against disruptions during, and then challenges with eviction, renoviction, or having the cost being passed down to them after the retrofit or after their tenancy ends, or being on the hook for upfront costs and things like that, is a significant challenge balancing these two. And the way that I have conceptualized this is in the form of a 2x2 matrix. And I'm sure all of us, if not most of us on this call, will agree that if we are to strive towards a policy ecosystem that leads to happy cats, I think that we would all consider that a policy win. So having both strong tenant policies and strong energy efficiency policies is a pathway towards affordable, appropriate, and secure net zero housing. But there is perils in this pathway is if we end up in an environment with strong energy efficiency policies. So examples of that could be mandatory building energy performance, mandatory rental housing standards. Without adequate tenant protection, it might lead to the cost being passed down to them. It might lead to renovation and eviction. And if so, we actually, I'll illustrate this with an example. So what we did was we began looking at policies, rental energy efficiency policies around the world. And so some of you may be familiar, we had a research report a couple of months ago called Efficiency for All, looking at low-income energy efficiency programs and what they're doing or not doing, what gaps exist. And so in this context, we look specifically at what are the policy approaches towards rental markets, especially considering that in Canada, a significant majority, and off the top of my head, I think, and folks in the Q&A can maybe correct me, between 85% of renters live in private rental housing, not in social or affordable housing, which is a significant sector. But in terms of numbers, the majority of rental households live in private market rentals. So what are the policies for private market rentals? And there's only two policy approaches. Number one is that conventionally, and even more so in Canada, a lot of the policy has been trying to do the carrots approach for landlords, which is to improve the business case for landlords, reducing the upfront cost for landlords to kind of get them induced demand in energy efficiency retrofits. And some contemporary approaches in jurisdictions from around the world, especially in the European Union, we're seeing mandatory policies. So mandatory building standards. If you're renting a house, it has to reach a certain energy efficiency standard and threshold that will compel landlords to improve energy efficiency of their rental properties. And so when we looked at the sort of conventional approach in policy approaches that we've seen in Canada with like upfront subsidies for improving energy efficiency, what we noticed is that most programs, if not all low-income energy efficiency programs, are not offered to renters. If they're offered to renters at all, they're extremely shallow retrofits. So you get like a couple of LEDs, you get a shower aerator, maybe you'll get a clothesline, and that's it. Deeper measures in most jurisdictions are often available for low-income homeowners, but renters are often left out. Fuel switching, so switching to net zero energy efficiency or net zero fuel standards or net zero heating fuels, more energy efficient heating sources like heat pumps are not a common standard feature, and the depth of investment and the scale of investment is not enough to reach our net zero goals, especially in the rental housing space. And so what this leads to is that in Canada, I would characterize our policy ecosystem as being weak on both energy efficiency policies because we rely heavily on improving the business case for landlords, and we also have weak tenant rights, weak tenant policies. In the European Union, there's been proposed building performance standards to help raise the energy efficiency performance of buildings. So that would be strong energy efficiency policies. But now, given the situation of the energy cost crisis in Europe, some legislation is trying to weaken some of that, providing exemptions to rental housing or exemptions to low-income housing, and that leads to the quadrant in the top left, which means it's a sad cat in the sense that it leads to substandard rental housing. So an example of how we can take this framework and apply to some of the things that we heard today would be, so the maximum temperature bylaw, that's largely within the municipal sphere. So we can take the approach of what we're calling a policy mix. So instead of pursuing individual linear policies in either energy efficiency or tenant rights, we can actually stack together a range of different policies to come up with a mix of policies that will put us in the top right quadrant. So as an example, a maximum temperature bylaw that some folks on the call today talked about at the municipal level can be supplemented with provincial funding or provincial legislation that offers tenants legal aid and counsel so that they can trigger energy efficiency improvements. We see examples of this in UK, and I won't go into this today, but tenants have the right to trigger and request an upgrade if there are programs available for landlords for improving energy efficiency. And so right now, a lot of federal programs like the Greener Homes program that are paying ability to pay households and homeowners up to $5,000 in grants and $40,000 in no interest loans are not available for renters. They're not available for landlords who want to improve energy efficiency for rental households. So federal government can step in and expand programs to include landlords who are willing to sign a covenant that says that they will keep their housing more affordable. So by strengthening tenant policies and strengthening energy efficiency policies, we can come up with a policy mix that makes sure that the actions that we take to reach our net zero goals also brings tenants and low-income households along with them, because at the moment, low-income households, especially renters, are last in line for any kind of energy efficiency upgrade. So that ends my presentation. Hopefully we are under time and hopefully under budget. And the report will come out in December of 2022, and it'll be available publicly, and I'll be happy to share that. And that will conclude my presentation today. We will jump into Q&A as soon as I stop sharing my screen, which will be in a moment. Okay, so Anna, can I break the rules here and by asking if you can unmute all of us so that we could do a round of applause for everyone that presented today? Is that possible?
I don't think I can do and unmute all that quickly. So those of you who wish, unmute yourselves.
I will invite folks. If you don't want to unmute yourself, that's fine. You can just get on camera or silent chat, do what it takes. Thanks, everyone that presented today and joined us. So we will segue smoothly, I hope, into the Q&A session. I'm going to look through the chat and go through questions. I will sequence them, I think, in the order that if there are specific questions for a specific presenter, I will start there. And then we will go into more general questions that maybe one of us on the panel can ask. So I will start with a question from my friend Mavanvi at Housing Services Corporation. The question was to CELA, is CELA consulting municipal social housing organizations? They're a large group with little funding that is doing a lot of retrofits at scale. This is particularly in regards to the green roofs recommendation that CELA is making.
Sure, so let's chat offline about it. So our idea with the green roof recommendation is that it would apply based on the space requirements that are outlined with a little bit more detail on our website. And I noticed there was another comment in the chat about weight requirements. So that is one of the restrictions that we saw when we were doing research about this, that there are some buildings where the weight of a green roof is, it can't be done. But other than that, yeah, it would apply to buildings that you're working on. Yeah. I don't know if that answers your question, Mafanwi. So follow up if you have a follow-up question.
Jacqueline, it'd be great to connect offline, and I appreciate this. I know it's maybe an opportunity that I can provide to kind of speak to a large stakeholder group in that particular area. They are doing a lot of progressive projects of passive house and deep energy and so on, and they own a lot of buildings, right? So they would be heavily impacted by this. So great to have a conversation. I'll connect with you. Thank you.
That's great.
Thanks, folks. I think the next question might also be for CELA, and any presenter can jump in to answer. So the question, I think, is that this is from Yvonne. I find that a larger challenge for municipalities is lacking the powers of enforcement, which also helps with data collection and tracking to ensure their bylaws actually have effect. Do legal precedents apply to enforcement?
So in terms of the enforcement powers of a municipality, there is a section of the Municipal Act that looks at enforcement powers. Those specific cases that Meg mentioned were about enacting a bylaw, but what I would recommend is looking at other municipal bylaws, looking at very similar issues like the provision of heat. So there are quite a few municipal bylaws that look at providing heat, and they have enforcement provisions, for instance. So that could be a good guide to how you would set that up.
Thanks, Jackie. Another question, I think this may have come up before your presentation, Jackie, but so I'll throw this out to maybe one of the other presenters if they want to jump in. So the questions were around what can municipalities do to encourage or require large property owners or landlords to upgrade and retrofit their properties to reduce emissions and protect resident health. So, and I think in particularly, this is talking about large institutional landlords. I would interpret this as talking about social housing providers or private rental property managers who manage a large real estate assets. Is there anything specific that municipalities can do to begin with sort of those institutional providers and then moving down to maybe small town landlord or small, mom and pop landlord?
I'm happy to jump in here. I think, municipalities can provide incentive programs to, increase efficiency. I mean, I know specifically for green roofs, Toronto does a green roof incentive program, which provides grants to homeowners or buildings that want to implement a green roof. So I think incentive programs can really help, this specifically.
Excellent. Thank you very much. And there was a question.
If I could jump in for a second. So to be a little bit controversial potentially, but what the CELA project was looking at is on the sort of mandatory province-wide legal requirement side of things. It was our view kind of as we delved into this issue that incentive programs and pilot programs and all that is great, but it's it's ending up with uneven protections, and there's still people falling through the cracks. And as we looked at it, again, kind of from this like human rights perspective, from the view of saying, okay, we need immediate action that makes it legally mandatory that these people are not going to be harmed or die in their apartments, we are looking at it much more from the perspective of mandatory requirements across the board. Pairing it with funding for sure, if that's available, and that's great. And that could be a source of advocacy.
Can I don't know if I'm breaking too many rules, but I'm going to break another one. Can I ask a question? Follow-up question to you, Jackie? Okay. Can you talk about what jurisdictions in Canada, if any, have a municipal bylaw for maximum heating, and what was the development process that led them to maybe putting that in place before your recommendations came out?
So Meg can jump in. I don't know that there is one that is exactly what we're calling for. There's one in Mississauga, but it doesn't apply to units that don't already have the infrastructure for air conditioning and or you know, heat pumps. I mean, whatever, like active cooling, which we are quite concerned about because it doesn't really reach the people that we're most concerned about here. Again, sort of trying to pair the policy response to the most vulnerable people. So there is the city of Montgomery in the United States has a maximum heat bylaw that was passed pretty recently, and that seems to be going well. So that's a good model to look at. And there was the usual, you know, concerns about cost and it can't be done and, you know, all this stuff. And then it was passed, and now there's been, you know, pretty good compliance, and, you know, it's moving forward. So that's great. It's a really good model for us.
Thanks, Jackie. Meg, were you going to jump in?
That's all I was going to say as well.
Right on, thank you. Oh, I muted myself. This might be a question for Dr. Green. Is there something, and actually this is from Dr. Lena Brand-Correa with York University. Is there something around like the liability of landlords given the direct heat impacts of heat as described by yourself, and something around health and safety? Is there something, landlords have responsibility?
I mean, I was wondering the same thing. Liability seems like it's a question for the lawyers. But there was a comment in the chat about difficulties with potential grid capacity constraints in Durham region. And what crossed my mind was, yeah, but this is about people dying from heat. Like, I don't know. I think we can cross that bridge when we come to it. And I don't think that should be like a barrier to implementing a maximum heat bylaw, maximum temperature bylaw. But maybe, yeah, that's a question for the lawyers.
So can I, before we jump back to Sela, Dr. Green, can I expand on that question? Because I got this from someone I was having an informal conversation with yesterday about this. And so what they were asking was, okay, let's put aside like liability and legal standards and all that. How do we change the culture of social responsibility around the landlord and tenant relationship? And this, I'll open this up to everyone, and not just landlord and tenant, but just around this issue. And I know you do a lot of advocacy, and you talk to a lot of people. You talk about the health impacts. What can we, as a group of people engaged on this topic, do to expand the conversation to talk more about social responsibility, not just between landlord and tenants, but like broader social responsibility for the health impacts of climate change?
Yeah, I'll just jump in with one point is I do think framing this issue around health is an important step. People respond much more swiftly to concerns around health. They take it much more seriously than if we're just talking about the environment. So I think using a health frame is definitely the way to go in all of our communications about this, whether it's like formal or informal, with friends, with politicians, etc. And I also think, likewise, we need to be like just incorporating this like climate resilience into every single decision that gets made at all levels, like at the level of the landlord and at the level of municipal government, provincial government. And that's what we're trying to do, like within the health system too, is just like, we think about patient safety and, we make decisions based on patient safety, even if they're more costly. And likewise, we need to be thinking about climate resilience and adaptation. And if it's more costly, it's more costly, but like, it's something we need to be considering regardless of cost.
Thank you, Dr. Geen. Ian Mcqueen with Durham, from Durham. Hi, Ian, by the way. Just flagged, and it was news to me, was that town of Ajax within Durham region also has a maximum temperature bylaw. And I agree with you, Ian, is that it's similar to Mississauga in that it only exists when the property has an air conditioning. So that makes sense. So a question from Helen, and this might be for you, Dr. Green, is that from a public health perspective, boards are required to investigate health hazards. I guess, sorry, I don't know if there's a question in here. I'm reading this live. Okay, Helen, thanks. I appreciate the clarification. You probably heard me stumble through this and you came to my rescue, and I appreciate that very much. So a question for some of the other folks, maybe Jane. Jane, you talked about impacts on seniors, especially in long-term care homes. We also know that seniors spend a lot of time indoors, even if they're not in long-term homes, and the impacts of heat is especially pernicious on seniors. Is there what practices have you seen in terms of like local action? I know Gordon and Joanna talked about the importance of local action. What measures can communities do to kind of like look out for each other, check in on seniors? What have you seen that has worked? Do you have any examples that you can point to outside of things that you've already talked about?
Yeah, the only thing that we ever really see is the cooling centers. I think that they're sort of informal within buildings, looking out for neighbors and that sort of thing. But I don't know that like how far that goes to help people, because I think that it, it can identify when people are ill and when they need help, but it doesn't really go to prevent the issue. I know that, there has been some work, and Samantha might know more about it, around like some of the Toronto housing had issues around people who had mental illnesses and had different issues, and, looking up and things like that. But, whether or not, they look out for people who might be having heat related issues, sort of the workers that are in those buildings. Might look at that in the summer, I don't know. But mostly we see the cooling centers, which, as I indicated, may not be close to people, may not be able to get transportation. So they're not necessarily really a great option for a lot of people.
Jane, there's a question in the chat, it's just popped up. Do you think the national or Ontario building codes need to change to require new builds for long-term care centers and nursing homes to require central air conditioning? Yep, go ahead.
Yeah, so it's interesting because they still have the 2015 building. The guide is still for the 2015, doesn't require it, but now they have a regulation that says you have to have air conditioning in the new rooms. So it's unclear whether or not buildings that are being built that are sort of underway are being built with air conditioning, or they're going to have to retrofit after. I'm presuming that no, and this may be a silly presumption knowing the Ministry of Long-Term Care, but I would hope that any new builds are going to be required to have air conditioning, because it's now required under the legislation. So it would be silly not to have it in there. I mean, I'm wondering, and I sort of put in the chat, and I don't know if anybody's looked at whether or not there's been any look at changing building codes for like rental accommodation. So we know that there's issues around retrofitting and stuff like that, but whether we should be saying that, rental accommodation or any kind of accommodation should be now built with mandatory air conditioning, understanding that old stock may not be like the old long-term care homes, we're going to have trouble retrofitting, but at least if we had the new stuff mandatory, that would go a long way. And I, it's unfortunate we were talking about how do you get the landlords to do it. I mean, my understanding of, way back when, of landlord and tenant legislation is that they had to put in things like you know, when did the landlord have to turn the heat on because they didn't want to do that and they were freezing people out? So unfortunately, you know, it doesn't seem to be something that, you know, all landlords want to do unless they're actually given that stick. So I'm just curious as whether or not there's any, you know, in the building code with respect to new builds or anything.
Thanks, Shane. And I'll jump in really quick to say at Efficiency Canada, we do a lot of work around building code adoption, helping provinces adopt like the model building codes, the 2020 model building codes, which are the more recent model building codes. And I can check with my team and follow up later on whether building codes are going to require for new builds any kind of you know, a cooling requirement or anything like that. My understanding is not, but I can check into that and follow up. And this actually leads me to another question, which is a lot of the, I'll just say that, what, if anything, do we see as the role for the federal government to play in this? Because I think we've discussed the municipal role through bylaws, we've discussed the provincial role through building codes and long-term care legislation, things like that. And in our system of like multi-level governance, and Gordon talked about multi-level governance, and Joanna touched on that a little bit. The federal government has weak powers when it comes to certain issues like building codes at the provincial level, or regulating health or regulating education. So what role, if any, do we see a responsible role for the federal government to play in this aspect of heat-related deaths? And I'll throw this open to presenters and pop in if you feel like you're ready to answer. Oh, Joanna has her hand up. Thanks, Joanna. Go ahead. If you have any thoughts, please put them in the comments.
So we've been involved quite a lot with the National Adaptation Strategy development, and there are a number of actions. I think the key is there are a number of federal actions ongoing around energy efficiency and emissions reduction, and there is a big overlap with some of the actions that would actually help for extreme heat. So at the moment, there's the EnerGuide and the Canada Greener Homes grants that people can access. But we're part of the discussion around the National Adaptation Strategy is, well, we need to roll out these kind of programs for climate resilience. And in particular, the overlap with extreme heat is huge. So there's also programs like the Canadian Infrastructure Bank are already funding kind of investing in retrofitting public buildings for energy efficiency, but we also need to do it for climate resilience. And then there's the federal government also released their green building strategy, which did not speak to extreme heat pretty much at all. So those are kind of some of the key areas that we see are moving at the moment. But I would say things are moving quite fast at the moment. There's a lot of strategies up in the air. We have not got the National Adaptation Strategy draft yet, but we need kind of key short-term actions in that document to drive things forward.
Thanks, Joanna. I'm sorry if I didn't notice your hand up earlier. The color of the hand blended really well with the post-apocalyptic background you have on your screen, so I apologize for that. Gordon, Professor Gordon, go ahead, please.
Yeah, just to follow up on what Joanna just said, is I think it's very important that we push on the federal government to actually go from, as I said in my comments, that from we've been talking about a national adaptation plan and strategy in this country for 20 years. What we need is a national adaptation implementation of actions that really move things ahead. And I think that the communities that are on this call can be very hopeful in trying to motivate that action. We're also, with the Institute for Catastrophic Loss Reduction, we have people who trying to work on the building code side of things. So any information there would be very valuable. We can exchange on we've got engineers and economists and other kind of people who can try and advocate this, and also work with the insurance companies. They're not always 100% supportive, but generally speaking, they do, because this is an area for which they will end up paying a lot of money and not look good and that kind of thing. And since Samantha is waving her head up and down, I think it's very important. No, I'm very pleased that, because I've always found in my presentations to public audiences, I give a lot of them. I'll do a Rotary Club one next weekend, or anyway, a week or so, is that stressing the health effects on people often motivates action. You might have known Samantha John Howard, who used to be head of the Canadian Association of Physicians for the Environment. He was a medical doctor here in London, Ontario, and we'd give seminars. If he was giving a seminar publicly, I'd be in the audience to berate anyone who was denying climate change. And if I was speaking, he'd be in the audience, so I could say, stand up, John, and say how much effect that has on human health. And that had impact. So working together across these issues and issues that, well, the Intact Center and ICLR need to cooperate and do. But anyway, trying to get this national adaptation strategy into being, actually, let's get it out as a real strategy that can be and will be implemented by all levels of government. Thank you.
Thanks, Professor Gordon. And I'll echo what both Joanne and Gordon said, is that I, as a part of my role at Efficiency Canada, I track low-income energy efficiency policies at the provincial and federal level, and there is a glaring lack of focus on low-income households or rental households and marginalized communities in federal policies around, particularly around buildings and housing and climate change. So the Green Building Strategy didn't specifically, as Joanna noted, note heat deaths or even note like the disproportionate impacts of and the challenges that low-income households face in accessing some of these funding. And even you look at the federal energy efficiency strategy or federal energy efficiency programs, right now, programs are not accessible for low-income households because their Greener Homes program requires upfront investment by a homeowner, and 1.6 million low-income Canadians are homeowners. And then you get the grant, and so and then you get the grant to kind of pay you back. So low-income Canadians lack the ability to invest upfront money on accessing some of these measures to improve housing conditions and reduce energy costs. And renters are completely left out of federal energy efficiency strategy. So I think that one of the things that I'm hoping maybe we'll dig into a little more deeply in our breakout rooms is identifying how we can tackle this like challenge of not being able to highlight the necessity for a targeted action on low-income energy efficiency, and maybe how we as a group can kind of work together towards those outcomes. I will go look at the chat now, and in the meantime, I want to put a question out to everyone, and seeing that we have 5 minutes left in the Q&A, up to the presenters. Thank you for sharing your work, and I'm actually curious to hear what are you working on next, and what kind of research can we anticipate coming from you, or research or advocacy or insights coming from you. And maybe I'll start with Jane, and Jane, maybe you can quickly tell us what you're working on next, and then we can go from there.
I think what we're sort of where we're going right now is to see what's happening with the implementation of the air conditioning in long-term care, with the appeals that are going on, homes that are not complying, why are they not complying, and the rebuilds. Part of the problem is that these homes were actually supposed to have been rebuilt 2 years ago. They had 10 years to rebuild and they didn't rebuild. And now they're in a big scramble. And for a variety of reasons, a lot of homes that are supposed to rebuild are not rebuilding. So there's a lot of issues with the infrastructure there, including that. So I think that's what we're going to be looking at next.
Thanks, Shane. Maybe Sheila can go next.
We'd love to see implementation of all of our recommendations. So we'd love to see some municipalities take us up on this offer to, implement a maximum heat bylaw, and same with the bylaws on urban tree cover and green roofs.
Right on. Thank you. Dr. Green?
All kinds of work locally, engaging with our patients on protecting themselves from the heat. And for me personally, trying to educate my fellow health professionals on the risk of extreme heat and other climate health risks locally. And then at CAPE, I'll just put a plug in, Canadian Association of Physicians for the Environment. We have our fossil fuel ad ban campaign. I'll put a link in the chat. comparing advertisement of fossil fuel products to advertisement of tobacco, since fossil fuels kill more people than tobacco. And we've just launched our complaint to the CRTC on greenwashing and fossil fuels.
Thanks, Dr. Green. Joanna?
Yeah, I'd probably say two things immediately relevant. So there is a workshop with a lot of federal government departments on standardization of heat risk mapping. So we're working on, that was one thing that we noted through our report, that actually Quebec municipalities actually have online, easily accessible mapping of heat islands done by CERFO. And we don't have that in the other provinces. So there's an opportunity and mapping doesn't treat the problem, but it helps to communicate the risk to people, raise awareness, and also target action. So that's an immediate action. And we have a report coming out next week about valuing the services from natural assets. So including kind of urban cooling. So things like, trees and vegetation cover in our cities is providing a service of cooling our cities. And we don't really value that in financial terms. So we have a report coming out about needing to, some cities have actually already valued their natural assets, over 90 local governments in Canada. And they want to put this on their financial statements, but they're not allowed because we have standards that exclude them. So this report comes out next Wednesday. So that's my next baby.
Thank you, Joanna. Professor Gordon?
Well, thank you. I just wanted to bring up a couple of things. First of all, support what Joanna and Jacqueline, and Samantha have all just said. It's very important that we bring these things together. One of the issues we've done recently in Canada is, well, I've been working with colleagues across the country to create what's called the Canadian Association of Professionals in Climate Change. And the idea is to get all the disciplines of people together. And we do have medical people, engineers, others. And the idea is to create an organization that would, first of all, provide certification for people, and just to, let's say, if you've read the latest IPCC report, one of the things it identifies in the North America chapter is that the climate change deniers are still having a significant impact, mainly in the United States, but somewhat in Canada. Say, stand up and speak out about that. And but anyway, I just say that there is this climate Professionals Association. The idea is to create an organization that would work together across the issues and the disciplines.
Thank you, Professor Gordon. I appreciate it very much. I'm sorry we are just on time for our break. Yeah. I apologize for jumping in. And so here's what we'll do. There's a 10-minute break. Do not leave Zoom. Stay on. Okay, thanks, folks. I hope that was an engaging discussion. So I'll kick off on the report back from the breakout room, and I took a whole bunch of notes, and I hope I'm reflecting the voices of everyone in my breakout room, which is breakout number one, room number one. We had folks from very diverse experiences, including some lived experience with impacts of heat, and serving in an advocacy capacity and a governance capacity on a bunch of different boards that relates to heat deaths. We had experts in the room, professionals who work in organizations that have broader, responsibility over housing and municipal governance and things like that. And so on the subject of, what should our priorities and goals be, I think something that stood out to me a lot is that we know, in this group at least, we know a lot about the impacts of climate and heat deaths, but we speak, we're also disparate. Like we all are working, we're all like chipping away at it. So I
started sending more.
Sorry, you might have to put yourself on mute. We talked about how we're all like the individual different groups, and then there might be a need to speak in like one collective voice. Because we all advocate for the same thing, but we've been kind of siloed off and working at this for a bunch of different angles. So we have different perspectives, but there's power in being able to organize together. So that should be one big priority. And then the challenge with that priority is, okay, how do we organize a bunch of different people who are extremely low in capacity? We're all overworked, perhaps underpaid. How do we get together as a group and advocate for something that we all share a common interest in? It was a challenge. Another big thing that stood out was public education. So how do we engage landlords? And we recognize that there are good landlords and bad landlords. Where are the good landlords? How do we find them? Do they understand that this can be a part of their broader social responsibility? How do we find them? How can we map them? What kind of tools, both governance tools, legislative tools, data tools, do we need to identify where the good landlords are, engage them in broader public advocacy? That is another thing that stood out to me. In terms of, and then the challenges with that is getting an entry point into. Some folks on the call talked about the challenges that some municipalities had with trying to identify landlords and license landlords. And then once you do that, in kind of being able to enforce some kind of standards. We also talked a little bit about, building labeling or something like that to let tenants know before they enter into a rental agreement what kind of the state of the house and what kind of energy bills they may expect to pay. And then doing that in a way that is informative for tenants and doesn't disrupt, doesn't have negative impacts on them and doesn't shame them, for example, for living in a low efficiency home, but also doing that in a way that is generative and helps put the pressure on landlords to improve condition of housing. I think the other big thing that jumped out to us was some folks talked about their experience in dealing on the front lines with issues between tenants and landlords and trying to mediate between them. And oftentimes the challenges that come up at that place are around mold issues or pest issues or water related issues. And heating related conditions hasn't really been brought up. Now, we reflected on the fact that part of the reason that could be is that maybe even tenants don't know what their rights are, or tenants don't know what their standard of their housing expects to be. And so if it's too warm, they may maybe just take it for granted. And so there's a call for some kind of broader advocacy, public education around informing tenants of what the expectations can be about, the level of warmth or heating in their homes. And so we brought all of this kind of together and said, in terms of next steps, I think it'll be useful for all of us to organize and maybe begin by just like immediate next steps, putting together a statement, articulating clearly what the problem is and giving specific direction and advice to different levels of government on how they can take action on what is starting to be and will continue to be an incredibly huge public health challenge and a social challenge and a climate change challenge for all of us. So that was breakout room number one. I may be biased, but I thought that was the best breakout room, but maybe I will be corrected when the next groups go. So I'll pass that down to breakout group number 2.
And that's Jackie.
Oh, great. I'm going to have to say that our breakout room was the best breakout room, Abby. So we spoke about some of the same themes. So I'll be a little bit more brief, but we spoke about many of the different sort of particular legal mechanisms or ways to respond to heat. And we spent a bit of time talking about tree cover in particular, and the very close connection between low income people and tree cover and all the benefits that come from helping with that. And the maximum heat bylaw as well. We spoke a lot about that, and there was a lot of interest in going forward with that recommendation. We talked a little bit about how very local solutions are sometimes the best ones in terms of who is most trusted at, by people is very local, community service providers, and doing low income barrier studies to really understand what the barriers are for very local people accessing services and dealing with extreme heat. A few people shared some really terrible stories about people dying from extreme heat that I wanted to bring up here as well, because I hope that we are conveying the urgency of the situation and of these issues in this conference and with all of our recommendations and presentations today. And we had a really interesting conversation as well about municipal action and what that looks like when there's two-tiered municipalities as opposed to single-tier municipalities, and some of the challenges that creates when there's sort of two different levels of government at the local level. And we also all just really were excited about connecting and meeting each other and exchanging contact information to work on this in the future. So that was really great, and always a wonderful part about having a conference. So that was cool.
Thanks, Jackie. Next is Emma.
Hello. So we talked about a lot of the same things, of course. And in our group, we had some more public health focused people, some legal people. We had a representative who was directly involved in the heat dome in BC last year. So an inside scoop on that. And a few of the things that came up in terms of the immediate needs, or the 3 to 5 years, what we really need to do, echoing the maximum heat bylaw, or Canada-wide something, really should be pushing that at whatever level, all of them, because it's just an easier place to start. Some words on a page is all you need to do to get that going. We also mentioned how the data piece is still really important. The numbers that came out of BC are quite striking and need to be, we need to continue to get that stuff across the country in order to relay the right information to, convince the people that need convincing about the urgency of this. And so that, as soon as we can get that in place, and, getting these health authorities and coroners involved, all of that stuff and the work that's being done, if that can continue, that would be really important in terms of continuing the push forward and getting everyone on the same page and understanding the need. We talked a bit about the existing low income issue in terms of accessing the retrofit money. And I mentioned how hopefully we'll see some proposed solutions to that from Abby at the end of the year. But also just the fact that, you put this cooling in a building, but that increases the energy cost for, operating the building. So how does that work? What can we do to mitigate that for people who then have to, deal with that in the end? And we also talked a little bit about alternatives to the mechanical cooling, which we will need that. But historically, buildings have been built without that stuff. And, they've been able to withstand some of this a bit better than maybe the buildings we build now. So maybe looking backward could help us a little bit in the move forward. We talked some about social responsibility as a whole, really, and everyone's role in that. So it went a little bit back to landlords, their responsibility to a tenant, as well as employers. So workplaces, or whether they're a building or people working outside, those employers have a right, or have the responsibility that the workers have a right to a safe working environment. And if heat is a factor in that, it has to be addressed, the same as any other workplace hazard. So where does that come in? Looking at my notes here. We also talked a bit about, as has been reflected here, the importance of this collective voice and the cross-disciplinary transfer of information and access to this information. So there may be groups, working on housing and need some of that climate background to really tie it all together. And we also talked a bit about how all of these separate issues are still often seen as separate by municipal officials or others, and how they really aren't. And whether we explicitly make the connection or not, we can use those as levers. So like focusing on health, everyone feels a direct connection to that. If it comes to housing, like that's a pretty hot topic already. So talking about, even if you don't use the word climate, whatever, if you're talking about housing, and housing should be safe, and housing should be affordable, and housing, all of those things are still connected to the things we want to do. So how do we make sure that across all of these groups, we have the same message? And We talked a little bit about emergency planning in terms of grid outages and communities being able to have platforms to connect with each other and build these groups of support so that vulnerable people can be protected if they aren't, you know, by the infrastructure that's around them. At least we could start with kind of grassroots support. And I think that's probably enough from me. Yeah, it was a good talk.
Thanks, Emma. And before we jump to breakout number 4, I just want to recognize and thank Emma for jumping in and stepping into the moderator's role on very short notice, just because I asked her to. So thank you, Emma.
No problem. Thanks for the invite.
And in a cleanup, we have Joanna.
Great. So, so we had a great discussion. Probably say that we were the best group, but anyway, it's not a competition. So we had there were many kind of different viewpoints and we covered a lot of ground. So I think some of the key things that came out were kind of the need for or the efficiency of mandatory standards, particularly around energy efficiency, heating or cooling for landlord action. There was kind of, there wasn't really anybody to defend the landlord point of view. So, so we didn't really hear about good stories from landlords, which, so that was a kind of one thing that came out of this. If there are good news stories or model buildings or landlord initiatives that worked, it would be good to share those to inspire others. And the fact that we can use incentives as well to get things to move faster, because there was a general feeling that landlords are not bought into this adaptation yet. There was a lot of agreement around the need for public education, not just of landlords, not just of kind of residents, but of everybody about heat risk and what we can do in advance to adapt, because you know, it affects everybody. The need to keep it simple as well so that people can understand. And that kind of fed on to the fact that the most vulnerable people often do not have the capacity to act themselves, whether that be in terms of monetary means or time or resources to do that. So air conditioning is often the most simple way forward, but we also discussed that in the absence of passive cooling measures at the same time as air conditioning, then, you know, the air conditioning actually costs more because you're having to run it more because the building itself is not energy efficient. And the role of utilities as well in kind of keeping the power on as well, the dangers that power outages pose if they occur in a heat wave. If we're completely reliant on air conditioning, then and we haven't put these energy efficiency measures in, then we'll be in an even worse pace. But whether also the utility companies' role in kind of subsidizing energy efficiency measures, which I know many of them do actually in Ontario at the moment also. And I think so we were kind of it got a little bit despondent because we're all kind of very much aware that climate change is here. We feel that we felt that, you know, it was evident to everybody that we need to do something and urgently. So I think that message came through from participants in the discussion. But the need to share, I guess the need to share good news stories also to keep our energy levels up at this, because, you know, it's easy to get discouraged otherwise and feel overwhelmed and actually not do anything. So the role of having kind of bite-sized things that people can manage to do to progress and step forward, I guess that was another thing that I took away from the discussion. So hopefully I've summarized adequately, but yeah, it was a good discussion.
Awesome. Thank you very much, Joanna. So I'm just checking my agenda here. Looks like we are ahead of schedule, which is fantastic for a virtual conference of this size. So if I get a big thumbs up from Anna and Z, I will go ahead. Oh, there's an adorable cat on my screen. I love it. Hi, Daniel. Sorry, it distracted me too much, but that's on me. So if I get a thumbs up from you, Z and Anna, I can wrap up and then have some closing thoughts. Sound good? Okay, I see no one stopping me, so I will go ahead. So, okay, so this is the hard part, right? So we've spent quite a few hours together, and I'll try to do my best job of a meta summary of what happened today. I'll try to speak from my heart, quite frankly. So if you'd asked me like a week ago, Abhi, how many people in the country are engaged on heat debts, I would have probably guessed a dozen, because I didn't look at the number of registrations for the LIEN conference. So the very fact that we had 200 people register for the conference, more than 100, I believe, actively participated today, and quite close to 60, 70 of them stayed back through the entirety of the conference on a busy Thursday to participate actively in the discussion. That brings me, talk about good news stories, right? That gives me a lot of confidence. Frankly, I find it inspiring, because it seems like this is an issue that a lot of us have been kind of chipping away in our own little silos. But the fact that so many of us share a common interest in an issue that is so urgent is a good news story for me for today. And in terms of presentations, we started talking, Joanna led us off, we started talking about like there's good news stories and bad news stories. A lot of the macro perspective of the first two presentations talked about how climate change, global impacts, and we're starting to see some of that in our communities. And both of them, both the first two presenters did a great job of stressing the importance of local action, local targeted action, especially in the context of like action coming from sources that community members can trust. And then we went into some discussion on direct health impacts. And how many, and actually some of the first two presentations touched on this as well. I think something that stood out to me that I think will stay with me for a long time is what one of the presenters said, which is heat death events are the highest number of deaths per event in communities in North America, and especially in Canada. And in our group discussions, we heard a lot of, in my group and in some of the other groups, we heard directly from people who were at the epicenter of some of these heat domes and heat deaths, and the direct impact it had on the lives of their friends and family, and then continues to have heat-related illness and sickness casts a long shadow through the lives of people that it affects, and it continues to live with them today. And so that was very important for, I think, a lot of us to hear. And it more so because a significant amount of these impacts affect low-income communities, renters, marginalized communities, communities that need help the most, that are also unfortunately in less of a position to take direct action, especially tenants and renters and low-income households that can't afford the upfront costs, or don't have the permission to, or aren't willing to take on the debt of doing the upfront costs of upgrading their homes to be more comfortable, to be more healthy, or to continue to pay the ongoing costs of managing that. So that called for like some legislative or structural approaches. And so in the last two presentations, we looked at that closely. Sila led a presentation with green roofs and a model legislation on adopting at the municipal level a maximum temperature bylaw, recognizing that there are a lot of provinces and actually municipalities in the country that have a minimum temperature bylaw in the winters, and modeling something that reflects the values of something like the minimum temperature bylaw to have a maximum temperature bylaw. And then in my presentation, I touched on the value of having policy mix approaches and the importance of taking action on strengthening tenant protection, strengthening tenant rights, and how tenant rights and improving housing, I'll say, and then improving energy efficiency and taking action on climate are the same thing. And they're not at cross purposes, they're not orthogonal, but it is actually important to take action on both of those simultaneously to advance our goals of having affordable, appropriate, and safe and secure net zero housing by 2050, and then having an immediate positive impact on the lives of people. And some of this was touched on as well in terms of like taking immediate actions. Finding alternatives to mechanical cooling, taking small-term actions, communities or self-organizing to protect them against extreme heat events was brought up. communities organizing to check in on each other and protecting them against power disruptions, and something all of these things were brought up, and that was also very important for us to hear. In the breakout room of discussion with the sort of the video and camera off, we were able to dig a little deeper into some of these conversations and to lean into some lived experience. And I think coming back to those three discussion questions, my big meta summary would be that I think the call to action that I'm hearing, and that we can follow up, and if you have anything more to add, please add so in the comments in the chat. I think the meta summary is that we need to organize as a group, and maybe start with small steps and celebrate our small wins. So begin by maybe something as simple as a statement of here's a group of us, researchers, advocates, doctors, frontline workers, people with lived experience. We've all come together. We've talked about this issue, and here's our statement. And this is a human rights issue, and whatever that ends up being in the statement, I don't want to editorialize it right now, but coming up with a clear statement that articulates our vision, our values, and the urgency of taking action on this, and setting some clear lines of sight for provincial municipal governments is, to me, jumps out as a long-term goal, but also an immediate step that we can take. Identifying like who are the stakeholders, and see, this got brought up in some of these discussions, like who, because this is housing as an issue touches, there are many touch points related to housing. So who are the stakeholders, who need to be invited at the table, who should have been here and who wasn't here today, who needs to be invited, how do we get in touch with them, who are the good landlords and how do we find them, how do we engage tenants and help them organize better, or organize, how do we give them more legal aid, more support so that they can self-organize and trigger retrofits and work with their landlords to provide, to improve the condition of their housing, is something that I think I see as a kind of a long-term goal, and something that we can start taking immediate steps on. In terms of challenges, we talked about bad landlords, data gaps, just getting the attention of provincial and federal governments and pressing upon them the importance of how this one issue actually connects across multiple dimensions of, security and security of tenure and housing and public health and climate change and vulnerability, and leaving no one behind in transition to net zero, and doing that in a way that doesn't dilute our message, that speaks very clearly, is something that some of us saw as our challenges. And then how do we as a group, a big group of people who are engaged on this issue, who are essentially running this off the side of our desks, how do we organize and work together, given our limits of capacity and how we're stretched? And then the third piece of this was like, what kind of tools do we need to enforce compliance from bad landlords, from behavior and things like that? Do we have the legislative and the legal tools to enforce some of these challenges, and doing so in a way that also continues to protect low-income communities and renters is something that we focus. So in terms of immediate next steps, I think it'll be useful for some of us and all of us to get together and maybe get the ball rolling on putting together a statement. And if anyone is interested in networking, and hopefully some of you have met other folks who are interested in this matter, and you're able to connect offline from this and work together in small groups. It doesn't have to be one big umbrella. We don't have to write things by committee. We can organize as small independent groups. And it was encouraging to hear that the research and the advocacy and the practice on this will continue. I know I can speak from Efficiency Canada's perspective and say that my whole role is to keep an eye on low-income energy efficiency and vulnerable communities in relation to improving energy efficiency in housing. Tenants and housing right is the next issue we're focused on. But we have a lot of research and a lot of data and a lot of tools that we're building so we can help folks around the call take action on this. I can perhaps speak from my position personally on the LIEN Stakeholder Committee and say that LIEN has always been a leader on this issue, and will continue to keep an eye on this and continue to advocate and intervene and speak to governments about this. And I hope the rest of you will continue to take your individual actions while we figure out how we can organize together as a group. And I feel like I have spoken enough I hope this was a good summary of a very long and eventful day, and I'll pass it on to Z to kind of wrap us up. And I want to thank everyone before I leave from the bottom of my heart for being here and for being engaged. Thanks.
Thank you. I want to thank you all for your participation today and for staying for the entire 3+ hours and engaging in fruitful discussion. Please feel free to reach out to me after the conference if you have any follow-up questions, or if you want to engage with us in any future advocacy work. Thank you to our presenters and moderators and note takers. And thank you so much to our Zoom tech guru, Anastasia, and our wonderful facilitator, Abby.
And thanks back to you, Z, because I know you worked really hard in putting all this together. And I applaud you and LIEN's effort, and Sila and Acto and everyone that continues to keep the heat on this issue.
Yeah.
I may allow the pun. Thanks all.
Thank you.
Have a wonderful day, everyone.